It was 11:43 on a Tuesday night when the phone rang. On the other end was a dog owner trying very hard not to panic. Dr. Scott Reynolds. I think he swallowed part of his favorite toy. In the background, I could hear a Labrador whining, pacing across the kitchen floor, then suddenly retching. No vomit. Just that awful, dry heaving sound every dog owner dreads. The toy was still lying on the floor, but one corner was missing. It wasn't hard plastic. It wasn't rope. It was that soft, colorful foam-like material found in some of the most popular chew toys sold today. The owner had almost reached for a little bread to help push it through, because someone online had suggested it. The truth is, that innocent idea could have made the situation much worse. What if the real danger isn't that your dog chewed the toy, but what happens after those tiny pieces disappear? Hi everyone, I'm Dr. Scott Reynolds, your neighborhood veterinarian. Cases involving swallowed toys are some of the most stressful emergencies I see, because they often begin with a dog acting almost completely normal, only to become seriously ill hours or even days later. Today I'm going to show you why certain toy materials create a much bigger risk than many owners realize, how a blockage actually forms inside the digestive tract, the warning signs you can safely check for at home, the mistake I see people make over and over again, and exactly where the line is between careful home monitoring and getting your dog to a veterinary hospital immediately. If videos like this help you become a calmer, more confident dog owner, consider subscribing so you don't miss future guides. Let's start with what is actually happening inside your dog's body. Most people imagine a swallowed toy sitting in the stomach like a marble in a bowl. That's not really how the digestive system works. Your dog's stomach is constantly squeezing, folding, and mixing food with digestive acids. Picture a washing machine gently tumbling clothes instead of spinning at full speed. Every few seconds the stomach contracts, pushing food toward a narrow exit called the pylorus. Only material that is soft enough or small enough can pass through that opening into the small intestine. Here's where certain toy materials become a problem. Many popular dog toys are made from soft thermoplastic rubber, foam composites, latex blends, or flexible synthetic polymers. These materials are designed to survive repeated chewing, which is great when the toy is outside the body. Unfortunately, those same properties often mean stomach acid cannot break them down efficiently. Instead of dissolving, they remain as rubbery fragments. Sometimes a tiny piece passes without causing trouble. Sometimes several small pieces clump together, and sometimes one piece reaches exactly the wrong place. The small intestine isn't one straight tube. It twists and loops through the abdomen like a long garden hose. As the intestinal muscles rhythmically squeeze food forward, anything that cannot move properly may become lodged. Once that happens, everything behind the blockage begins backing up. Food can't move, fluid can't move, gas can't move, pressure builds. Imagine putting your thumb over the end of a hose while water is still flowing. The water doesn't disappear, it simply has nowhere to go. Your dog's digestive tract behaves in a surprisingly similar way. That's why vomiting is often one of the earliest warning signs. The stomach keeps trying to empty itself, but the road ahead is blocked. One thing surprises many owners. The blockage itself is often not the first problem. Dehydration begins surprisingly quickly, because repeated vomiting removes fluids, while the intestines can no longer absorb water normally. Blood flow to the trapped section of intestine may also decrease if pressure becomes severe. Left untreated, that lack of circulation can damage intestinal tissue, allowing bacteria that normally stay safely inside the gut to leak into the abdomen. That's when a difficult surgical case can become a life-threatening emergency. Fortunately, not every dog that chews a toy develops a blockage. The size of the fragment matters, the shape matters, the material matters, and the size of your dog matters. A Great Dane may pass something that could completely obstruct the intestine of a Chihuahua. That doesn't mean larger dogs are safe. I've removed surprisingly large objects from surprisingly large patients. It simply means every situation has to be judged individually. So what can you actually check safely at home? Start by looking at the toy itself. If you notice fresh bite marks and an entire section is missing, don't assume your dog spat it out just because you can't find the missing piece. Search the room carefully before concluding it was swallowed. Next, watch your dog's behavior instead of focusing only on appetite. A dog that happily eats breakfast but vomits shortly afterward deserves much closer attention than many people realize. Likewise, repeated lip licking, excessive drooling, pacing, stretching into a prayer position, or trying to vomit without bringing anything up can all suggest abdominal discomfort. Another safe observation is energy level. Does your dog still greet you enthusiastically? Does he want to play? Or is he repeatedly lying down, getting back up, and struggling to get comfortable. Dogs are remarkably good at hiding pain. Often it's the subtle changes that tell the real story. One myth I hear constantly is that if a dog is still drinking water, the blockage can't be serious. Unfortunately, that's simply not true. Many dogs with partial intestinal blockages continue drinking for quite some time. Some even continue eating small meals. The digestive tract doesn't always become completely blocked all at once. Problems can develop gradually as swelling increases or as the foreign material shifts deeper into the intestine. Now let's talk about the mistake that worries veterinarians the most, because it's usually done with the best intentions. A surprising number of owners try to push the object through by feeding bread, pumpkin, rice, or a large meal immediately after they suspect something was swallowed. It sounds logical. If food moves through the intestines, maybe it will carry the object with it. But if that object is already lodged or beginning to catch inside the intestine, adding more food simply means adding more material behind the obstruction. Instead of helping, you may increase pressure, worsening vomiting and discomfort while delaying the veterinary examination that could prevent much more serious complications. There is a much safer approach, and it starts with understanding exactly what your dog swallowed, how long ago it happened, and which situations can sometimes be monitored carefully versus those that require immediate intervention. That's where we'll continue next. The safest first step is actually the least dramatic one. Stay calm and gather information before trying to fix the problem yourself. If you actually saw your dog swallow part of the toy, make a note of the exact time. Keep the remaining toy pieces and, if possible, the packaging. Different materials behave differently inside the digestive tract, and knowing whether the toy was solid rubber, foam, latex, nylon, or a fabric composite helps your veterinarian judge the level of risk much more quickly. If the swallowing happened within the last hour or two, and your dog is acting completely normal, call your veterinary clinic immediately, even if it's after hours. This is one of those situations where a phone call can genuinely change the outcome. In some carefully selected cases, a veterinarian may decide it's appropriate to induce vomiting, but this decision depends on what was swallowed, how long ago it happened, your dog's size, and medical history. It should never be attempted simply because you found instructions online. Here's the safety rule I want every dog owner to remember. Never try to make your dog vomit unless a veterinarian specifically tells you to do so. Certain toy materials can scrape the esophagus on the way back up. Some swallowed objects are sharp. Others can be accidentally inhaled into the lungs during vomiting, creating an entirely different emergency. If your veterinarian recommends home monitoring instead of immediate treatment, your job changes from fixing the problem to becoming an excellent observer. Offer fresh water as normal, unless you've been instructed otherwise. Allow your dog to rest. Watch every bowel movement if possible. It isn't glamorous, but it can provide valuable information. Occasionally, very small, soft fragments pass naturally without causing any issues. However, don't assume everything is fine simply because you find one tiny piece. Another fragment may still be inside. During this observation period, pay close attention to the pattern of symptoms rather than a single isolated event. One episode of vomiting followed by a happy, playful dog may have a very different meaning than repeated vomiting every few hours. A dog that refuses breakfast, then lunch, then dinner, tells a different story than one that misses a single meal but quickly returns to normal. Patterns matter. Now let's talk about something I recommend surprisingly often, because it's simple, inexpensive, and incredibly useful. Take short videos. If your dog is retching, coughing, stretching strangely, or showing unusual behavior, record 30 to 60 seconds on your phone before rushing out the door if it's safe to do so. Why? Because dogs have an incredible talent for acting perfectly healthy the moment they walk into the veterinary clinic. I can't count how many times an owner has told me he was vomiting every 10 minutes, only for the patient to sit calmly in the exam room, looking completely innocent. A short video allows your veterinarian to see exactly what you saw at home. That can make a tremendous difference when deciding whether we're looking at nausea, abdominal pain, coughing, regurgitation, or something else entirely. Here's another small trick that many experienced veterinarians appreciate. Bring the damaged toy with you, not just a photograph, the actual toy. The size of the missing section often helps estimate the size of the swallowed fragment. We can compare bite marks, material thickness, flexibility, and density. Sometimes that information answers questions before an X-ray is even taken. Speaking of X-rays, here's another misconception worth clearing up. Many owners assume every swallowed toy will appear clearly on an X-ray. Not necessarily. Rubber, foam, cloth, and many synthetic materials are what veterinarians call radiolucent, meaning they don't always show up well on standard radiographs. Instead, we often look for indirect signs, such as trapped gas, abnormal intestinal loops, or unusual fluid patterns. In some cases, an ultrasound provides much more useful information because it allows us to watch the intestines moving in real time and identify foreign material that X-rays cannot easily reveal. This is exactly why waiting several days to see what happens can sometimes make treatment much more difficult. The earlier we identify a developing blockage, the more options we usually have. Now we need to draw a very clear safety boundary. If your dog repeatedly vomits, cannot keep water down, develops a swollen or painful abdomen, becomes unusually quiet or weak, repeatedly tries to vomit without producing anything, cries when picked up, refuses food for more than a day after a suspected swallowing event, or you notice pale gums, collapse, or difficulty breathing, home care stops immediately. Those are not symptoms to watch overnight. Those are symptoms to get into a veterinary hospital as quickly as possible. Your veterinarian has tools you simply don't have at home. Physical examination, abdominal X-rays, ultrasound, blood work, intravenous fluids, prescription medications, endoscopy to remove objects from the stomach in selected cases, and surgery when necessary, can all become critical depending on where the object is located and how long it has been there. One thing I always tell worried owners is this: needing veterinary treatment does not mean you failed. Dogs explore the world with their mouths. Labradors, golden retrievers, beagles, boxers, young German shepherds, and countless other curious breeds can swallow something unexpected despite having wonderful, attentive owners. I've treated dogs that swallowed socks, corn cobs, pacifiers, rocks, fishing lures, baby toys, rubber ducks, tennis balls, and even television remote controls. It happens far more often than most people realize. The goal isn't perfection. The goal is recognizing a problem early enough to give your dog the best possible outcome. So let's put everything together. A missing piece of a soft toy isn't automatically an emergency, but it should never be ignored. Resist the temptation to feed extra food in hopes of pushing it through. Don't attempt home remedies that promise to dissolve rubber or magically move foreign objects. Observe carefully, document what you see, contact your veterinarian promptly, and know exactly which warning signs mean it's time to stop watching and start driving. I'd love to hear from you. Has your dog ever destroyed a toy in a way that genuinely scared you? Or have you ever had to rush to the emergency vet because something unexpected was swallowed? I read every single comment, and your experience may help another worried dog owner realize they're not alone. If this video helped you feel more prepared instead of more frightened, consider liking and subscribing so more pet owners can find reliable information before a small mistake becomes a major emergency. I'm Dr. Scott Reynolds, your neighborhood veterinarian. Stay safe, give your dog an extra scratch behind the ears from me, and I'll see you in the next one.